views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Good evening and welcome to BronxTalk. So don't you just love your health plan? I'm guessing a very small percentage of Bronxites would say yes to that. High premiums, high deductibles, and an inability to choose your own doctors are just some of the most glaring issues. And then add in confusing medical bills and inadequate coverage for some chronic ailments, and you have what we would call in plain language a mess. Is the system fixable? Does it need overhauling? If so, how? Many, many questions that you have and I have, and we will try to get you some answers from a couple of experts tonight. She is the president of the New York State Nurses Association, an ER nurse at Montefiore Medical Center for more than 30 years, which deserves our applause and respect. She has passion for the campaign for New York Health. Please join me in welcoming longtime Bronxite, Judy Sheridan-González. Nice to have you with us.
Thank you for inviting us on the show.
And also the health policy digital organizer, I don't even know what that means, from the Community Service Society of New York, and that has a number of health care support systems, and we'll go through what those are. Ms. Emily Dore, nice to have you with us.
Thank you.
Nurse Gonzalez, let's start with you. Let's just tap into some of those years of experience. Can you talk a little bit about what patients are saying or about their health plan, what decisions are being made that might not be medically perfect or the best decisions because of a health plan? So I'm assuming that in many cases, when people have that, got to make a quick decision because your major health is affected, some of those decisions are compromised by what insurance do we have?
Well, I think one of the things that we see in the emergency department is the failure of the healthcare system. Many people, because of the nature of their insurance or because of various policies, put off going to see a provider for minor things that could be major things because of the co-pays and because of the premiums, or because perhaps they don't have any health insurance or the deductible is so high. So they end up getting very sick and coming to the emergency room for care, or they just don't know what else to do and they come to the emergency room for care because primary care is a big problem under the current healthcare systems. There's not enough primary care facilities, and the conditions in primary care facilities are not that conducive to people seeking that kind of care. So we see people who come to the emergency room, which we say is an inappropriate ER visit for something that's perhaps minor.
Should have been dealt with elsewhere.
Exactly.
Or at a much cheaper cost for everybody.
Way cheaper, way
Right.
cheaper. Or very, very sick because they didn't follow up on their high blood pressure, or for example,
The problem was exacerbated because of it.
people can't afford their meds, so they cut their pills in half. Instead of controlling their high blood pressure, they have a stroke. People's health plans don't cover enough mental health visits. So you have a teenager who didn't get the proper therapy, who has an overdose.
Or acted out in some form that caused a problem to themselves or
Exactly.
their
Or
others.
women's health is a big issue. You know, very often women have gynecological problems. They wait forever for appointments. They wait forever for an ultrasound. They come to the emergency room, and sometimes they lose their uterus. Totally unnecessary procedure.
When you talked about people without health care, the Affordable Care Act originally mandated people to get health care. Did everybody do that? And then I believe the regulations were backed off
Right.
most recently. So what is the status of that? Because the whole notion of mandating health care or people walking into the ER without insurance, I just can't even imagine, aside from dealing with them medically, how you deal with it.
Well, the problem with the Affordable Care Act is that there's the platinum, the gold, the bronze, all these different plans. The plans that people could even afford, and most people who don't have health care very often can't afford these plans. The deductibles are so high, the premiums are high, the copays are high for the cheaper plan. So they have the plan, perhaps, but they can't access it because they can't afford the cost of getting care. Again, coming to the ER instead because things have gotten so bad.
What about the decisions that are then made? What do you do? If somebody comes in, their insurance doesn't cover it. Do you say, well, sorry, we probably should amputate that finger or whatever it is, but we can't do that because there's just nobody to pay for it? Or does Montefiore Medical Center somehow absorb the cost or have some fund that handles the cost? Because I can't imagine being, aside from all the medical issues, you know what the emergency rooms are like, dealing with that whole component of it, getting literally in the middle of decision making.
As caregivers, we don't get involved in the weeds of how the insurance works, but what the public doesn't know, if people are uninsured, there's something called charity care, and you end up paying for that with higher premiums because there are people who are uninsured who,
So when you say you end up paying for that, who ends up?
The public.
The public pays
Anyone with health insurance ends up paying higher premiums to cover the cost of charity care for people who are uninsured, or they have catastrophic Medicaid for people who have no means, who can get some kind of insurance to deal with an emergent issue, because everyone can come to the emergency room without being turned away.
Before we get Ms. Dore involved and talk about some of the resources that CSS brings to bear, let's just talk about that for a second. People would say, well, wait a minute, why should I pay for somebody who can't afford it? In some cases, maybe undocumented, which creates even more upsetness. And people say, well, wait a minute, why are we paying for these people? It's not fair. I could fully understand that.
Well, I think it has to do, there's, for the Campaign for New York Health or a universal health care plan, there are clinical issues, there are moral issues, and there are financial issues, which I think we'll talk about a little bit later.
Yeah,
but
we're certainly going to talk about the campaign and where it fits into this.
As
I
a
want to
society,
lay out everything. Yeah.
We haven't reached that point in which we're willing to allow people to die on the streets or deliver babies in alleyways. We're not at that level, and I hope we never get to that level. So therefore, people...
Some people would think we are at that level. That's another
Well,
thought.
I mean, there's definitely a lot to say about that. New York State and New York City is much more generous in caring for indigent people than other states, and you definitely see much more tragic situations in other states than in New York.
Ms. Dore, let's talk about community service societies. So your agenda is, listen, we've had CSS on the program for a number of different issues, but is to do good. What is the general outlook at CSS, and what do you provide for the general public?
So 3 different main things in terms of health, and that's what I'll focus on, is first I'll talk about the program that I run. It's called We the Patients New York.
We the Patient.
We the Patients New York.
We the Patients New York.
Yes, because
Okay.
you never know, it might go national. It's the newest program Community Service Society is doing. It's really geared at direct to consumer, so it's making it, it's making it so there's a space where patients can really rally around any issue, whether it be a single payer, a partner of ours, or any other kind of healthcare issue. You give them a platform to talk about it online. So through social media, we have a website, to sign petitions online, and then come in for educational trainings. So folks can learn how to, call their legislator or go in for a lobby visit or any sort of thing like that.
Well, to understand, the background of what Nurse Sheridan said, Nurse González said, about a lot of these issues, then you feel like you have a platform that you can say, well, wait a minute, this is out of control for myself and my family. What can I do to impact that?
And I think it's a really nice space situated in Community Service Society, because through all of our work up until I got hired for this program, we were doing direct service only. So we were helping folks get enrolled. So community health advocates, that's one of the programs we do where lots of people can call in, help get their health insurance navigated, get enrolled, if they're having billing issues. So we had all these people that were calling in, and we were hearing all of these issues. So while we have attorneys, social workers, navigators on staff that can help solve one-to-one issues, we really wanted to create a space where we could capitalize on the idea that people are angry, people are upset, people are frustrated with their current
They don't
healthcare.
know what the heck to do. I mean,
Exactly, they don't know what to do.
Listen, I hear about it. I'm involved in it myself,
Right.
my family. Nobody knows what to do.
And what about a lot of people that have a lot of stories they need to say. Like, we might help resolve a billing issue, but then what if they want to tell their legislator or just someone online, like, hey, this awful thing
And
happened
it
to me.
certainly helps them to feel less alone, let's put it that way.
Exactly.
I would think, given the way I introduced the issue here tonight and also through everything else that's going on, that you would be inundated. That once you opened it
are.
up and said, we want to help answer your healthcare questions, I'm guessing the phone doesn't stop. Like you couldn't have enough
No.
people picking up the phone.
No, we have a robust, wonderful group of volunteers that are constantly helping solve these issues. And then for me personally, you know, we just had our first kind of educational training and the room was packed, just full of people. And then I want to also mention on the policy side, because all this stuff was happening, you know, we're doing direct services here. I'm running the advocacy, education, digital organizing piece of it all. We kept hearing certain issues come up over and over and over again. And so we actually put together a bill with Senator Rivera and Assemblymember Godfrey. It's called the Patient.
Who's the chair of the Health Committee in the Assembly?
Yes.
Right. And Senator Rivera is the Bronx Assembly
Exactly.
state senator who is chair of the Health Committee in the Senate.
Exactly. It's called the Patient Medical Debt Protection Act.
Right.
And that is a 7-part bill that was actually just mentioned in the New York Times this Saturday with an article called "With Medical Bills Skyrocketing, More Hospitals Are Suing for Payment." And when you were speaking, it really rang a bell that these high deductible costs, co-payments, it causes people to have a higher burden of cost. And then as a result, lots of times not-for-profit hospitals are suing. And one of those that's been really big that we've seen is New York Presbyterian. And so in this bill, it's a 7-part bill, and I won't bore you with.
Yeah. Well, what I do want to get to, and I'm going to ask each of you. So, what's the most common complaint issue that people pick up the phone and ask about? Is there one, or I'm sure there's 50?
I think what we see the most is that people are inundated with bills. That they're just a bill from their laboratory, a bill from here, a bill from there, and they don't know if they paid it.
Right.
They don't know if they don't know anything. They don't know what's going on.
You are now telling this story of my life around my desk and at home. That's exactly there's a piles
We
of
have
bills.
people with stacks of bills.
And I just want to. Do you want to one anecdote of maybe the many you've seen of somebody who had their medical situation compromised based on some of the things you had said? Is there?
There's so
every
many.
day.
I think you see people who ran out of, asthma pumps are very expensive. People who, I think
These
there
are
was-
all treatable. I mean, this is I
Right.
don't want to say correctable, but treatable.
And asthma is fatal. I think there was a story about a young girl actor that died from an asthma attack very recently. But if it's not treated quickly, it can kill you and it kills children. The Bronx is the asthma capital of the world. We have the highest asthma rates in the state, the nation, and totally preventable. A lot of these things, people running out of their meds and coming in, beyond where we can help them.
I want to get into this bill thing because the medical, the financial side of it, which you've already established, is an issue, and certainly you talked about. So I was given this bill by a Bronx woman who said, I want you to look at this, and this was one of the inspirations for doing this program, and we can put it up on the screen, and I don't know how well people can see it, but what this was and then we're going to ask each of you experts to go through it. This was a bill for a regular visit, a regular checkup, and so you could, if you look at it, folks, a regular checkup, and the bill came to at the bottom. You could see there $3,910, and there I'm just going to review it. Lab charges. Then insurance payment, then the whole business of contractual write-offs, that's in the first part of it. Then the second part of it, a new patient evaluation, $1,200. There's even a brief emotional or behavioral assessment at $80, which was really, as I was told, it was pretty much a question of, so how you feeling today? And the response was, well, everything's okay. My family is, we're all working like just about anybody else. And they charge $80 for that. What I want to get into, so the insurance company paid $83 out of the $23.51 at the top, and they paid $525 at the one in this lower section. But this whole insurance adjustment thing, so they billed $23.51, and then the insurance adjustment was $22.12.79. I guess for you, Ms. Dore, what the heck is that? And then the patient is supposed to pay $128. Why don't they make the insurance adjustment? Whatever the balance would be. I guess that would be about $203.40, and then that bill for the patient goes away. I'm sorry, Ms. Dore is laughing. You can show her on the screen. But it just doesn't make any sense. And this is an actual bill that a patient received.
Right.
So can you explain it?
And I can only speak some. You may be able to speak a little bit further. All I can say is I can speak from the patient point of view and from what I'm hearing from folks. And this is the big problem that we keep seeing, is that if someone looks at this, they're like, why is it costing me $80 to be asked how my day is? And then, wait, my insurance takes it away. Wait, they paid it, they adjusted it. There's no clear idea of why you're getting charged as much as you are, how much they're taking away, and then why are they adjusting for it?
So you don't really have an answer for
I don't.
So this contractual write-off clearly is an agreement between the providers and the insurance companies to say, well, if we have a bill, then you will write it off, I guess. Well, why make the bill, that top section is $23.51. Why make it that high to begin with? Or why not just, as I said, adjust whatever it would be, $22.40 or $23.40, and that adjustment, then that $128 goes away. Do you want to weigh in on this?
Yeah.
It just struck me as crazy, and it motivated me to say, well, you know what? We ought to do a program on it, because I couldn't believe what I was seeing. $3,900 for a doctor's visit.
I mean,
it's crazy.
people get these bills all the time, and one anecdote that I could share with you is a lot of the elderly are very concerned about getting these bills. They want to pay their bills.
Yes, and if you're younger, you're concerned too. But go ahead.
But you
because they want to make sure to pay it.
You just
younger
find
people
there's
like to
much
hang
more
with.
angst about it. And I had a patient, we've had several, but I remember one distinctly, maybe about 2 years ago, who came in distraught over this bill and proceeded to have a heart attack, getting so excited about. Literally had a heart attack.
Wow.
He came in to complain about the bill. They couldn't explain it to his best understanding, and then he started clutching his chest and turned out to have an acute myocardial infarction from the stress. And we see people's blood pressures go up. So there's no regulation. There's no regulation at all. People can charge whatever they want. You see different hospitals from private sector, from public sector, and in other states with the for-profit sector, all charging different charges for everything. There's no rhyme or reason for it. But what's really interesting to me, I think there's a psychological component. It's sort of like if you go to Target and you pay $28 for a dress, you go to Macy's and you'll see the dress is marked down from $170 down to $32,
Yeah.
and you think, oh, that's a great deal. Like, oh, they could charge
So
me
they were
$3,000.
so nice to me to charge $23.51,
It's only
and all I have to
$128.
pay $35.
Exactly.
Right.
And then what happens, what we find also, they bill you. You get the bill in the mail. And if you're a person who succumbs to angst, you'll just want to pay that bill. Then you find out they didn't really bill your second insurer, or they didn't make the adjustment. And then you find out that, in fact, you didn't even need to pay that bill, because the way they do it is it takes so long to get reimbursed, they start putting you in collections. We have a lot of our own nurses are in collections when we're not supposed to pay anything because of the health plan we have.
I don't know which of you, maybe both of you, want to weigh in on this. Is there a cost to the general public because they charge $23.51 for the I guess whatever the first segment is over there, or a total of $3,900? In other words, what would be the difference in the world if they just charge like a normal amount? Even, I don't know, $500. I'm not good at measuring what's true. In other words, or would it matter? Why don't they just charge $5,000 instead of $3,900? Doesn't.
I mean, there's obviously a cost to everything. The issue is that these costs are designed to, in my opinion, to manipulate the system in such a way that the hospital doesn't have to eat whatever is the problem. And when insurance costs go up, the hospital doesn't pay it. It goes to the public. It goes on a whole different lot of levels, which is why with the Campaign for New York Health, when people talk about what's the cost, there's all these hidden costs that people are paying that they have no idea that they're paying.
And they may not even know what they are. Also, you're paying, again, $80 for a psychological assessment. That's
I like the one that says insertion of needle into vein for collection of blood sample, $51. I do that all the time. I would love to get $51 for every
time
I stick a needle into a vein.
Needle into every patient that
that's
comes in.
Extraordinary.
I know that Nurse Gonzalez has strong feelings about the campaign for New York Health. Does CSS have a political position on it, or because one of the things we promised at the beginning of the show is we're going to talk about solutions.
Right.
Talk to me about what do you just take a step back and look at solutions?
Sure. Yeah. So, Community Service Society supports and has endorsed the New York Health Act, and it's one of our active partners. And our policy arm, Healthcare for All New York, HCFANY for short, works with, a bunch of coalitions to one, support the single payer, but also on certain policies around undocumented folks getting more coverage. And then the biggest thing that we're currently pushing is this sort of like Patient Protection Act, where it's really curbing unfair medical billing practices like this,
Right.
and then trying to fix the issue of affordability, and then really aiming at ending medical debt. Because I think we hear it all the time in news articles. I think Bernie
Right.
Sanders has been
And
talking about it.
Right, and ending that, you could deal with it on the very practical current level, but then
Sure.
there's the visionary level of it. So let's talk about the campaign for New York Health. We've had Senator Rivera on the show. We've discussed it. I guess the biggest thing that comes out is nobody's going to be able to afford it, and it's going to cost too much. I don't know how many trillions. Elizabeth Warren said her Medicare for All plan would work, and that scares everybody. Talk to me about the finances of it, the possibilities of having everybody covered. Of course, I think we'll all just say, oh, good idea.
I mean, it's hard to talk about finances without looking at finances. I think people could go to the Campaign for New York Health website and get a lot of the data on it to show, spend the time on the show talking about the different costs. I mean, I guess people could look at this. This is in color on the website.
Well, let's just talk in generality. So here's what was presented. I believe it was Senator Biaggi was on our show at one point, or I've seen, I've moderated some forums, and she was there. And she said, look, it's very simple. Take all the monies that you or others are putting into the healthcare insurance and move that over to just a different way of delivering healthcare. Are those monies sufficient to pay for it? And then, of course, do you or anybody concerned about insurance companies that might get hurt along the way? And, of course, that could mean jobs, et cetera, et cetera.
Well, we have a real shortage of healthcare providers and caregivers. So, I mean, the concept of a just transition for jobs that would be lost in the insurance industry into actually healthcare providers and creating a different kind of a system of healthcare where healthcare could be found much better in the community. There's so many needs. Certainly you're aware of the New York State Nurses Association fight for better staffing and hiring more nurses. There's estimated to be hundreds of thousands of nurses that are going to be short.
I think there's been a
home care.
nursing shortage for a dozen years at least.
So jobs, people can be trained for jobs to actually provide care instead of playing this role in these predatory companies that deny care. I think one of the other things I wanted to talk about is for people who do have health insurance, who think that they have good insurance. Very often I see the end product of that where they find out this particular provider isn't covered, this particular treatment isn't covered.
That is a very big issue because you, if I can just interject, you could sign up for somebody off a plan off the exchange because, well, my GP is covered. The next thing you know, you need to go to see an orthopedist, and now you can't find one, or the one that your GP knows or recommends or works with is not covered under your plan. Then what do? Then you go, and then you're into in-network or out-of-network, and it becomes incredibly complicated.
Or even if you have a good employer plan or a good union plan, a lot of times people, then they change the administrator plan. Like you go from Aetna to Blue Cross Blue Shield, or you find out that your pharmacy only will approve a particular drug or a particular treatment. You need an MRI for your knee, but you have to go through 6 months of painful therapy, even though you know that you have debris in your knee.
We got it. So what is this? Is the New York Health Act
So
a
the New York
solution to this?
The New York Health Act would cover every type of treatment, including eye, dental care, orthopedic care, long-term care. There'd be you'd have just a little card, like a Medicare card, but there'd be no out-of-pocket. It would be a payroll tax for 80% for employer, 20% for the employee, and that's where, for example, this economic analysis of the Health Act.
So that 20% would be replacing what I guess we're all paying for.
Well, according to the data that we have, if you made $400,000 a year, you'd end up it would cost you a little more. A family making $200,000 would gain $2,000 and change in savings. So anyone very, very rich would be paying more, but all the way down the line, people would be paying less in the net cost.
Before we run out of time, Ms. Dore, I just want to talk about the helpline.
Sure.
I pulled out the phone number. I think we can put it up on the screen.
Yeah.
It's 888-614-5400.
Yes.
And I'm sorry if you get a million calls after this, because everybody's going to say,
No.
I have a question, I got to talk to somebody. What do you do?
I also think it's important because it's open enrollment time.
Yes.
So if there's any,
That's now through the first of the year?
it's through the 31st
31st of January.
of January.
Okay.
So if folks are having issues getting enrolled, have questions, or have current, switching plans, or even if they're already insured and have like bills they want to dispute, just give us a call. That's what we're here
Good.
for. All free. Our attorneys will take care of you.
888-614-5400. That's
Yes,
the
and
phone
it's
number.
called the Consumer Health Advocates Helpline.
Wow. Tremendous. Listen,
Yes.
just the fact that you have it, I don't know how inundated you'll be, but just the fact that you have it,
Right.
I think it'll help people say, well, maybe if I really do have a question, I can call. And now where are we at, just to wrap up, where are we at with the campaign for New York Health and the New York Health Act?
Well-
It's obviously going to come up through the next legislative session. What do you think?
Well, we have a lot of sponsors. The Senate, we're a little boondoggled right now. I think that we have to really get a lot of the people, a lot of the stakeholders at the table to perfect it. There are things that can be done to make everybody happy, except for insurance companies and pharmaceutical companies and some of the larger medical centers.
So you concede that if there's a cost, that's where the cost will go. I don't mean financial cost.
We're
if there's
talking
a-
about doing away with most of these private health insurance
Right.
plans. There's people who
Right.
obviously make a lot of money. They're the CEOs of big pharma and
I
insurance
want
companies.
to ask this question. I got about, 10 seconds. They're going to yell at me. We got to go. Was the Affordable Care Act a mistake, or it was something a good start and now just needs to be developed maybe into something else?
It improved the quality of the life of some people, but you can't keep putting Band-Aids on a gaping wound.
There you go. Emily Dore from the Community Service Society, thank you so much.
Thank you.
And Judy Sheridan-González, thank you for your great work at the Montefiore Medical Center and also the Nurses Association, all the other great work that you do. And folks, if you have further questions, who doesn't have further questions on this, or comments, or anything you heard on tonight's show, or anything going on in the Bronx, then email them to us at BronxTalk@thebronxnet.org. You can send us a tweet at BronxTalk or post them on our Facebook page. We always thank our producer, Helen Greenberg, our director, Nick Marrero, our guests. We thank you for hanging in there and trying to keep your families healthy in the Bronx. We'll see you next week.